Anyway, lower your camera. All I can see is your nose and your forehead. There you go. Hello, everybody. I appreciate everybody coming. I'm talking to you live from our headquarters in Lake Mary. So this will be the last of our webinars for this year, but I think we have a good set of webinars for you coming up in January, and we'll start working on what we're going to talk about in February over the holidays. So look forward to having some really solid panels and as well as experts coming for in the new year. So since this is the last one of the year, let me just wish you, happy holidays, Merry Christmas, Happy Hanukkah, and certainly a wonderful new year. I hope it's the best one yet for you. I think it'll certainly be a big change from this year, right? I think there's lots of us that are ready to 2020 and start a new 2021 and get away from this COVID mess. I do hope your families are safe. I know it's coming, COVID's coming back. So as you enjoy this holiday, I hope you stay safe. And as always, if there's anything that we can do for you, please let us know. All right. So today we're going to talk about healthcare. This is one of the exciting things for me. I love RPA for healthcare. We were looking at what industry we were really going to focus icebreaker accounts on, and we had different ones. We certainly, logistics is one of our biggest clients, our biggest sectors. Telecom's one of our biggest sectors. Certainly technology, software. We run a lot of software, the infrastructure for a lot of SaaS companies, and so that was a thought. But I wouldn't have it. Healthcare is what we will focus on going into the new year, building out a catalog. Just because I think there's unlimited use cases. Right now we're up to about 130 use cases in healthcare that we are having active conversations in and have on the pipeline with somebody. And so, I just think that because of the way there's not too many EMR systems. So if you build an automation for one EMR, let's say Epic, we integrate Epic into, say, the clinical registry for strokes. Well, if we've done it for one Epic customer, we've done it pretty much for the vast majority, 80 to 90% could be reused for the next customer and the next customer and the next customer. And then if you think about, going from Epic to Cerner, since we've already done the work with the registry, then it's just a matter of doing 50% of the rework back to Cerner, instead of instead of Epic. So there's a lot of reuse in healthcare. There's a lot of use cases in healthcare, and so that's what we're going to talk a little bit today. I'm going to spend about 5 minutes just going through some different use cases that I just mentioned. I'm going to go through them really quickly because we kind of have them in modules, if you will. We'll talk about the modules. If you're interested in getting the list of these use cases, send us an email. We will absolutely share a PDF with you. I don't have a problem doing that. And then after I go through some of the use cases, then Val's going to actually show a few demos within healthcare just to kind of give you a flavor of what can be done. I'm really excited. I'll talk about one specifically that I'm really excited about. Before I jump in, if you don't mind. So one of the use cases that we're talking to is going in and using NLP, using AI to basically crawl through medical records, and we're doing this now with a couple of EMRs, to crawl through the medical record, identify keywords, key terms that we now have a database of, basically pull that out and then recommend or suggest what the optimal billing for those, all the different billing codes that could be optimized for that billing code. But in addition to that, we're now working on a project, we're about to kick off a project where we're going to run several systems past medical claims through an AI engine so that it learns. And then what we can do after that is then predict, give you a percentage of likelihood that something would be, accepted. So it might be, you can do this code and it's 93% likely to be accepted. Or it could be this code, and it could be 37% likely to be. And then you can kind of make a determination. You actually set a business rules engine up to do it automatically, or you can have a person review it and determine what's the likelihood, what's the optimization codes that they want to do, which ones they want to select and choose for when they do coding. So in practices that aren't that big, we're still talking about $1 million a year in billing. So you can imagine if we start getting into some of these bigger ones, just how big of a difference it'll make in billing. So let me share my screen. I apologize, I should have probably had this up beginning, but we will share my screen. And let's look for some healthcare use cases here. Actually, I'm going to pull this up as well too while we're looking. I'm going to walk you through a use case of one RPA and the business case, the return that they got just from having one RPA automation. All right, so let's do this. All right, so I think all of y'all know who Team is. But if you don't know us, we're headquartered in Orlando. We have operations in Europe and Latin America. We're also looking at Asia. We're also now expanding down in Buenos Aires, and we're looking at doing an acquisition in Romania as well too. If this says 700, we now are over 1,000. So, or will be by the end of the year when all these acquisitions happen. So we focus on a series of really, if you think about it, we're digital innovation, digital experience, which is driven by, as a core platform, cloud. And then the cloud integrates the three A's, right? Applications, automations, and analytics. You can throw AI in there if you want a fourth. So the cloud is the platform that really drives and connects all of these things to be able to drive digital experiences and customer experiences. And that's typically what we do. So we're going to talk specifically about the automation piece of that today. But if you're interested in any other areas, we can certainly talk to you about that. And then from an industry operations and around automation, we certainly have experience in a multitude of industries. And again, we're going to talk about healthcare specifically today. So the industry, so we broke this out into some modules. So patient intake and discharge. Now, let me just say, not all of these are going to be for everybody. We go through these quite a lot. And somebody goes, well, my EMR does that. Okay, but there's a lot of systems and a lot of healthcare that may not do that. And so each one of these are specifically a use case that is in discussion with clients today, or has been built, or is being built. It's in one of those three categories. So the first one that we did is kind of just patient intake and discharge, right? And then the second module is patient experience, right? So I can't tell you how irritated I am every time I have to put my Social Security on 17 forms when I go to the doctor. There's no need for it. It's crazy. So just whether it's form integration or pre-registration, appointment scheduling, pre-auth is a big one, right? Just improving that patient experience is a big piece. RPA can certainly help with that. Certainly the care coordination as well too. We write a lot of systems with patient engagement after. So think a stroke patient who leaves the hospital, that continuum of care so that you don't have readmittance. So automation around that whole thing, whether that's CRM automation or whether that's RPA automation, just being able to engage, with that customer to understand and give feedback is the way that you need to, we are trying to help hospitals and healthcare systems improve that patient engagement and patient experience for that matter. All right, and then of course, remote monitoring is certainly an easy one. All right, so then beyond the patient experience, there's a few more. We have clinical, right? So this is another one. I'm going to show you a use case on a clinical one here. One of the best uses of RPA is through reconciliations and audits. Like if you think, so certainly going out and looking, everybody kind of gets going out to a web and pulling some information out, being able to, if you're looking for a pre-auth and you're waiting on the phone and it's basically a bot that you're talking to on the other end, why you would have to wait to talk to a bot, I have no idea. It's a different story. We do have a catalog for healthcare insurance as well too, because There's lots of things you can do to make the process better for the providers as well too. But why not create a bot that talks to their bot? Like, why would anybody sit on the phone and wait for that? That makes no sense, right? Another use case is we're talking to a couple of chief medical officers, where they want to walk in. They have the kind of just like your cell phone, you have something in their ear, they have the microphone down by their mouth, and they're talking, and that's being transcribed into AWS. AWS transcribes it, and then we have bots that go update, Epic, Cerner, all scripts in this case. So that's something that's we're just starting. We've kind of done the solution design and starting to do development, but I think there's going to be a huge use case for that. Like I talked about audits and reconciliations. One of the things we've done is create bots for going in and looking at EMRs, looking at every record in an EMR. Because it's bots and automated and you can work 24/7, you can pretty much do an audit every day if you wanted to. You could look at every record, every field within that record, and determine if there was any information that was missing, any information that didn't match, any information that maybe was in the wrong format, any forms that were missing, something, and so make a master list so that you don't have healthcare, the workers, the providers, actually into, and typically that's usually nurses, right, that are going into the EMRs and doing that manually. So I think that's a huge space that we can, give. We can give hours back to care, and by hours I mean hours per shift per caregiver. So, all right, moving on. And another big one is drug interaction and diversion. There is a shortage there, and I think that's an area that almost everybody we've talked to is interested in, as well as kind of that integration with lab results. Case management's another big one within clinical. And then let's just talk about credential management. We all know how difficult that is. In today's world with, the workflow K2, which is now Nintex, UiPath, there is very little reason why you can't create very comprehensive, very easy to manage credential management systems. And so this is an area that we're piloting with a couple of partners as well as a couple of clients, and I think we're going to be able to have a product that we can take to market here pretty quick. All right, then there's HIM, and I'm not going to go through all of these, but basically I will tell you a story. My wife went to surgery. She had surgery and pretty major surgery, and come to find out, like a week later, the doctor got the medical records from the different doctors that we did like a week after the surgery, right? Wouldn't have been nice to have that information beforehand, right? So just being able to go out and retrieve medical records, request it, validate that they've come in, send alerts if they're not in, that entire process is something that can be handled with bots pretty effectively. All right. And then the last one, or the last two, certainly there's a lot around rev cycle. Rev cycle is probably the number one area that people are looking at this around, we need to get our money, right? People, I heard something the other day that I think is absolutely accurate and really important when it comes to healthcare. You can't give if you don't get. You have to get first to be able to give. If you got no money to give, how can you give anything to the family or to your relatives, right? You have to get to give, right? And so with healthcare, a lot of people think, people got to go into healthcare and you're harassing them but if healthcare systems aren't healthy, if healthcare systems don't have a good flow of money, they can't give. They can't provide the services that we all need. And so, this is really a passion of mine. I think there's a lot of areas that we can provide assistance in automating that will help the cash flow and the CFOs manage that business. And then if you've automated that, the one good thing about that is on the rev cycle, if you automate it, then you can apply AI to it. And if you apply AI to it, now you can start doing macro as well as micro level cash flow analysis. And that's a huge benefit to a lot of CFOs. All right. I'll get off my soapbox for a minute, but there's a lot of things you can do here. Collection automation, we work a lot with collection automation. And certainly AP workflows from a vendor side, GPOs, etc. We have a platform called FinBot that we have built that automates AP and really tracks the entire approval process, PO process, and even payment process if you want to go all the way through payment. All right, some bank reconciliations. Again, we mentioned that. You know, what I find is in healthcare, there's not a lot of the financial systems aren't great at doing the bank reconciliation, cash reconciliations, etc. And so we oftentimes, that's one of the first areas we can go in and add some value very quickly and kind of improve an area that's weak in a lot of places. And then supply, let's not forget supply chain optimization. Supply chain optimization has one, you know, it's number 15 here, like one category. But the truth of the matter, there's probably 100 different supply chain automations we could do. That's kind of a broad category that we lumped into one area. But supply chain optimization, another one's scheduling. If you put an AI engine, we're building for Sora down in South America. They got about 5,500 healthcare professionals. We're building a dynamic scheduling engine for them using SmartBot technology and K2 workflows to basically schedule out 4 to 6 months, but then every week, so that's the macro kind of scheduling, but then on the micro level scheduling, every week it gets adjusted, or every 2 weeks it gets adjusted for people being sick, people leaving, you know, et cetera, et cetera. And so what they're forecasting is, you know, for every % variance that you provide, you're talking, you know, millions of dollars for most healthcare systems. So if you go from you know, I think the average is 8% variance, you're either between 92% or 108%, most healthcare organizations in scheduling. And there's problems either way. If you don't schedule enough, then people get burned out and they leave, and turnover, and that's a big issue. If you don't schedule enough, then people, you know, you either overpay or you send home people and people don't make the hours that they want, and that's a different kind of problem. So the idea is not only are you going to impact customer satisfaction, you know, quality of care, but you're also, you know, for every % variance that you're going to reduce, you're going to save millions of dollars. I think in this case, we're going to be somewhere between 2 to 2.5% variance. So it's a pretty good solution. All right. And then I'm going to do the last one, and then we're going to get on to some demos because I know that's why you came here. All right, so healthcare reporting is certainly an area that, you know, reporting is probably the first thing that we do for most companies when we go in and do RPA. And it doesn't matter if it's healthcare or across the place. How many spreadsheets do you have, right? It's crazy how many organizations spreadsheet. Matter of fact, the reason I got into RPA the first time is we had a company called Accurian that did clinical help with clinical studies, recruiting patients for clinical studies. And they had a dashboard they were measuring all of their marketing techniques with. And they came in, they said they wanted to automate that. And I was, you know, I was like, really? Don't waste my time. It's a spreadsheet. Well, come to find out, they had like 15 people working in it 10 hours a week. So they had basically 2.5 FTEs working on the spreadsheet. So we were able to drop that down to like 10 hours. Each one of them spent about an hour a week in it, and everything else was automated. And so, you know, the savings on that was astronomical. So, you know, you're talking about $150,000 savings on a $75,000 project to automate. And so that's what really got me turned on, or listening to RPA and how it could be a game changer for business 3 years ago. And every client that I've seen since has very similar types of reporting that we can help work with. So, all right, I'm going to stop that. I want to just really quickly walk you through a business case for healthcare. This is a business case we did for a client. If I can find it. Didn't I just open it? Okay, well, let me open it again. Sorry about that. So this is a PCC client, Point Quick Care. They have about 130 facilities. And so we did what we call a feasibility study, where we kind of go over the background. We do a high-level workflow. In this case, there was 2 workflows that we were looking at. It's all around the auditing of their EMR. We talked about the project scope. And then we did assumptions. And by the way, they gave us all these numbers. We didn't do these numbers. We asked them for them, and their financial team came up with the numbers they wanted to use. And so we did the assumptions, and we came up with an ROI. Now, those two processes for them are going to be basically, they spend about $7 million a year on these audits, and the as-is case. And as they grow, that's going to continue to climb. The estimated yearly cost with our RPA was only going to be $2 million. So they got basically a $4.5 million savings, right? Now they asked us to do a revenue share with them. So we get roughly 10% of that. It's a little bit more complicated of a formula, but that's roughly. And so their 3-year comparison, as is, they'd be spending 22 million. And in their, after we done through with the automation, then this is the worst case, was $8 million. Right? So if you look at that accumulated savings over 3 years, they're basically going to save 15, which we get roughly 10% of. And so their net savings on that's 3 million. On that's two workflows that we're implementing within 13 weeks. I think it's actually 10 weeks we're going to implement them, but somewhere between 10 and 13 weeks we will have those workflows done. And they don't have to pay anything until we get those done and they're validated and we hit our acceptance criteria. Then when we move them into production and they start seeing the savings, then we will charge them a percentage of those savings. So this is the acceptance criteria. And then this is our methodology we're going to use to do it. And this is actually the schedule. So as you can tell, we're well in process. This did get delayed until September, so we finish up right around the end of the year. So I thought I would just show you that. So now I'm going to turn this over to V for the next 30 minutes. She's going to kind of walk you through some healthcare demos. V, let me shut down my screen here.
Thank you, Tommy.
Let me do that. All right, now, everybody, this is V. I think I've met her before. She's been with me on probably 8 or 10 of these now. She's our product manager that builds healthcare. She's actually working on the healthcare catalog with me. And so I've asked her to do the demo. So V, I'm turning it over to you.
Sure. Thank you, Tommy. So the first demo that we have on healthcare, it's a document classifier. Let me switch real quick to the recording. So what we have here is it's an AI system that's able to tell you which type of document well your file is. So we've created an AI system where you can upload your files that we're actually using for some of our healthcare clients. This is trying to understand healthcare documents and healthcare lab results and files. The system tells us, with a accuracy percentage what type of document it is, and then with OCR we extract information, and with that we are able to enable or to trigger a workflow of actions. So let me just play this recording. Okay, so here we've just uploaded the file to the system and it's telling us that it's a photo, 99.9% of accuracy. Same for the second one. So there are three main things to keep in mind about the system. The first one is that it's able to tell you the type of document, right? And it can be trained for any documents that you wanted to recognize. So at this point, for example, it recognized that was a behavioral form, and here it's also recognizing that this is an EKG, right? And with that information, then we're running the documents through OCR. That's the second thing, or the second main feature to keep in mind about the system. And with OCR, we're extracting key pieces of information to then be used, or use that information in the workflow that we're going to trigger. So here we have patient information, MRN number, and we do the same with all the files.
They didn't know my knee looked that bad, did they?
And then with that information, knowing the type of document that is plus the patient information, we can trigger either an RPA or an automated workflow to perform some clicks on the EHR system, to upload files to the patient profile, to update medical records, any type of action that need to be done, could be just automated with this information that's been extracted here. Okay, that was our first.
Let me just kind of
Sure.
talk about that. So what this is, so I'm gonna, and maybe I should have qualified this a little bit before we started, but what we have built for a healthcare system is basically a three-part system. First of all is the OCR part, right? Smart OCR. So you hope it's AI-driven OCR, but it can be just normal OCR. So whatever tool you've already got into your hospital system, and I imagine most of you already have them, you can use that. It doesn't matter what the OCR component is. It's just a matter of getting it into the system. The second piece is now, then we have built with Microsoft Azure AI. We basically built the components to read that document, recognize what kind of document it is, understand what kind of data needs to be pulled off of it, pull that data off, store it somewhere, and then kick off a workflow, right? So, and then that's the third part is the workflow. So people ask me, does it matter if it's UiPath? No, doesn't matter if UiPath, Blue Prism, K2, open source. Doesn't, it doesn't really matter what the workflow tool is. It's whatever you have or have a preference for, already paying for a license for, we can use that to kick off the workflows. The idea, though, is that, in this case, with this hospital, they had almost 100 document types, and they were doing 3 to 4 million documents a year. Actually, I think once we did the numbers, it's actually maybe closer to 5. But what they had, I believe they had 13 people in the operation and another 5 auditing. So, and when we get done with that, they're going to have probably 3, and they're going to be able to take and retrain the other 15 into higher value tasks. And so it can be a significant discount. And in this case, I'll get the answer, give you the answer. If we replace 15 people, well, what was the cost of the solution that we built? And so it's, it's depends because it's a variable, but it's somewhere around $30,000 or $40,000 a month. So, so they're going to spend, let's be on the safe side, say 400,000 a year, but they're going to be able to save, over $1 million a year. Actually, I think we did do 30,000, so I think it's 350,000 a year. But they're going to be able to save 15. They're going to be able to move over 15 people, and I believe the average salary with costs and everything else was around 60,000. So it was right. It was a little bit over $1 million they were going to save. They were going to spend 350, and then the second part of that is the amount of errors was drastically reduced, down to where the errors were under 2%, which was a pretty significant drop. And then the third thing is just the speed of processing at which they were going to be able to get the data done because they were so backlogged. So it had a pretty high ROI. Now that we've built it, they were the first one that came, so they probably had a little bit higher cost than most. I think, I would say for most hospitals, it's probably a $20,000 to $25,000 solution per month. And in most cases that we've seen, it'll be over $1 million in cost savings. So, okay, go ahead. Sorry about that.
No problem. So this second process that we have here, it's actually medical record scanning. So we are going to the EMR with this automation that we put together. We are going through the medical records of each of the patients, getting all the details on the diagnosis, on the ICDs and codes that were added to each of the patient profile. And then with that information, we're comparing that with the ICD-10 codes against the CPT codes to be able to understand whether they are a good match or not, or if there's a mistake, or if there's something that needs to be added. So then they could be, the bill, so that the billing could be good for them and they don't have any issues with rejections or denials.
And
So
before you jump
it's
in,
basically, yep.
before you jump in, let me just add one thing. Sorry about that, Vic.
Yeah, no worries.
So I just want to explain who Vault is. So Vault is a client of ours. We built their EMR. It's an EMR for post-acute, particularly for the real specialty is for physical therapy. So they have low-cost centers. Or they built an EMR for SNFs and rehabs. And so we built the EMR, we support the EMR, and then in this project, they followed up, they came back and they asked us to do some of the AI behind it. But I just wanted to kind of, if you weren't familiar with Vault, they are a EMR for post-acute.
Thank you, Tommy. Okay, so I'm gonna play the bot, the recording. At this point, the bot is going through each of the sections within the patient's profile. First one being the diagnosis. From here, it collects the ICD-10 codes, understands, it uses natural language processing, so it can go through the history and medical notes and understand what the doctor or the provider has added there. And with that information, it would match it against the ICD-10 codes to make sure that they're good, right? And then the ICD-10 will be matched with the CPT codes. Any scenario, any error, anything will be flagged by the robot. Of course, all of this is HIPAA compliant, so at the end, we're not storing information anywhere. We're not putting together a report. We're just saving it on a web URL, on a web location, and from there, providers can just access the final report and understand the issues and go back and fix them to enable higher billing or to improve or decrease denials and increase, of course, the revenue. So as I was saying, information is not stored anywhere. Here's every piece of information that was extracted from that patient profile, and then with this information, we just create a final report. Of course, we're not showing that for because it's sensitive information, but that report it's a web report, and anyone can access that, and then take the further actions that are required to fix the things and then make the billing work. Okay.
So
And
let me just throw in something there as you're
sure.
doing. We slowed this down dramatically, right, to kind of show this. This is something that happens in a split second. So we had to try to slow this down and video this. So if I don't want you to think that the system itself is running slow. We kind of tried to have it time it and kind of do a script around it, just because. Um, um, most of what you're seeing here happens in the background and happens in a split second. So, um, but uh, but for the sake of this demo, we wanted to slow it down so you could actually see what was going on.
Yeah, that's a good point. Thank you, Tommy. Okay. And then our third and last demo, it's about revenue cycle reporting. So what we're going to see here is the bot just going through information that's coming from the EMR system, right? Consolidating all of that information into a single Excel file, into a single report that follows certain template, follows validations, it applies some rules and things related to the process, analyzes the data, turns that report into a PDF format, exports it, and then sends it to the stakeholders, to the final process owners. This process right here is showing from the step where we have the input files on a local machine, but of course in the background the bot has already gone to the EMR system and downloaded those reports. Of course, since that's sensitive information, it's not showing in the demo, but um, the reports information is being downloaded to an Excel file, and then from those Excel files, um, the bot is using those Excel files to create a final report. So here we're gonna launch the robot. And here the robot will start opening and closing multiple Excel windows. That's the bot just extracting information, input information, and then pasting that information here on the template. Of course, as it pastes the information, it is validating it, applying rules, doing some calculations and math. And then when it has the final report, it prints it to PDF format, and in the background it sent it to the stakeholders. So in a minute we're going to see the email containing this exact same report. Of course, this could be a template that you guys have. The bot can do a template from scratch. It could be a Power BI dashboard. It could be many things that we could use in the RPA for the RPA. So this is the final report. I don't know, Tommy, you're going to add something there?
No, I just think I think it's a good example. Do we have the COVID reporting demo that we could show?
Yeah, sure. Yeah,
Why don't we
sure.
show that?
Let me find it real quick. So what we did here, we put together a robot to be able to go to a web portal, uh, fill out a government form for a hospital. So this form, it's for COVID report, it's a COVID reporting purposes. So right here from the Excel that you saw first, that's the input file. The bot's taking information from there, and then it's coming here to this Javart website. It's opening this form and going through each of the sections, each of the fields, through each of the tabs, and pasting that information here. This bot, it's intelligent enough to be able to handle any new field that appears in the form, since the form is not a very stable website. I mean, this changes constantly, so the bot is able to handle changes accordingly and to notify the human where new information is required, um, and send multiple notifications if something's happened. But the bot, in essence, the bot just takes the input file, analyzes the data, then comes to the website, logs in as a human would do, and then pastes this information here. As you can see, it's numeric information, but if it was maybe drop down or radio button fields or any kind of button fields, then the bot would be also able to handle that, as you can see right here. Checkboxes is also a feature or a capability that the bot can handle. And then at the end, of course, the bot produces a final report, a summary report to the end user, showing them, well, today we've processed this many input files or this many requests or this many forms. Please take a look at what we did. Here are the issues or the problems, the things that you need to fix manually. And well, of course, notifications are always considered in in the RPAs. And of course, we're seeing like it could be a web form, or it could be a desktop application, it could be an EMR system, it could be, as long as it's repetitive, as long as the bot can have access to human or background access, that's also a possibility. So if we have access to a database or things like that, then we could handle it easily, and we can just run the process same as a human would do.
And I'll just say again, we've slowed this way down as we did the recording, because in live, this takes about 30 seconds to do the whole thing.
Or most of the times this is done in the background, Tommy. Like sometimes you're not even able to see what's going on with the bot, because there are a lot of background activities, but of course for demo purposes we try to be up from activities so we can show something, but the most optimal way to run the bot is in the background, and that's the way we do it. But then if we did it like that for the demos, then we wouldn't have anything to show.
Yep. And again, this is once we've done this for reporting for one state, what we've found in investigation is most of the states, or a good portion of the states, use the same database. They just .New Mexico or .Texas or .whatever. And so once we've done the entry, then the question is, and we have a format for that, can you get the information into that format? Typically it's done a big percentage of it we've done with Epic, so we can, if you have Epic developers, and if not, we can do it. But we can create an Epic report to put it in that format and kind of automate the daily reporting. Now, they are always changing the rules and different, so there is some tweaking that has to go on. But for a lot of hospitals, a lot of people who are struggling with reporting, finding time and having multiple people have to enter in COVID information into the state databases, this is a very cost-saving or cost-effective and it's a cost-effective solution that saves a lot of time. I guess that's what I'm trying to say, and usually some time of some of your highest value people. So this this bot that you see in most circumstances costs between $1,000 and $1,500 a month to implement, get it ready, and then moving it. So if that's something that you're interested in, certainly let us know about that, because we do believe the people that we've implemented for have found it to be very successful. All right, so I was wanted to show the registries as well too, the integration with registries, but I don't think we're going to have enough time. I'm thinking we're right around 10 minutes, right?
Yeah, I just wanted to do a recap.
Yep.
Small recap. So we've seen document classifier demo, which classifies healthcare documents, right, and extracts information from each of the documents to then enable automated workflows. The medical recording scanning, which is just an auditing between ICs and codes and CPT to flag scenarios that like unmatching scenarios that require human intervention. And then revenue cycle, that is, it's of course for reporting. It could be any kind of report or any kind of format. BI tools are also encouraged in processes like this. And well, you want to talk about the upcoming webinars, Tommy?
So yeah, we can do that. I just wanted to wrap up on healthcare. Let's see if we have any questions before we talk about it in upcoming webinars.
Yep.
So, Ted, do we have any questions that are out there? Did we lose Ted?
No, she's there.
Well, if you had questions, we will then write them up and we'll answer them, and we'll see if she joins in the meantime. Yeah, let's talk about next month. So we're going to come up with some of the most common mistakes when starting RPA. I think we're going to kick off with that. Again, we got a lot of requests for that, so I think that's what we're going to start off. And then I think we're on, those dates are wrong. All right, so what we're first going to do is talk about automation and the first one of the series in January is automating the automations. Right, we're going to talk about, a lot of people are asking about how they support and maintain and how they get the most value out of bots. So we're going to talk a lot around AI and then also automating the automations. The second thing we're going to talk about is we're going to do a demo of a scheduling system, a healthcare scheduling system that I mentioned that we did for SOAR down in South America using K2 workflows. And then we're going to show the document classifier. It's a different version of what you saw today, where we've used it in oil and gas. We've used it now in finance, looking at income statements to basically scan with intelligent-driven AI or intelligent-driven OCR, and then having K2 workflows that basically drive processes behind that OCR. So we're going to talk about that, the scheduling, I believe, and the second week, we're going to talk about automation, automating the automations. The third week, we're going to talk about the dynamic scheduling. And then the third week, we're going to go back and kind of show intelligent OCR and workflow. And that'll be our lineup for January. So I think I'm pretty excited about it. We're working on some pretty good demos and proof of concepts. We're trying to take the proof of concepts and make them into a pretty compelling demo that we'll have Julio on. Basically, our CTO down in Medellin will be driving that with K2. So, and then on the first one, if you missed Steve Moritz earlier this year or earlier this month, Steve will be doing the automations. So we have a good lineup for you. We hope that it'll be entertaining for you. Ted, are you there now? Is there any questions before we head out?
No,
Okay.
Tony, we don't have questions at the moment.
Is that because we did such a great job, or is that?
Yeah, you did a great job.
All right. So if you do have questions for us, you want the use cases, you see any demo that you were interested in us showing. I'm sorry we didn't get around to a couple of other ones that we had ready to go. We'll try to maybe reschedule another healthcare and do a few more. We certainly have a few of them in our arsenal that we can show. Just let us know, and we'll glad to do it for you and your organization, directly for you and your organization. So, thanks, B. I appreciate it. Great job as always. Have a great day, everyone.
Thank you, Tommy. Bye-bye. Take care.
Thank you.